and this is really an international conference. And now we fly again to Europe, but not in Europe, but in North Africa, and we'll ask to give a presentation to Narjess Boutalbi from Annaba University from Algeria.
Yes, do you hear me?
Yes, very well.
Yes. Hello, I'm Narjess Boutalbi from Annaba in Algeria. I work at the Sainte Thérèse Pediatric Clinic. I want to thank Professor Lubrano for this initiative. So I will share with you our experience. As you will see, we managed the epidemic in very different way here in Algeria, adapted to the situation. So for the first question, Sainte Thérèse is the principal children's hospital here in Annaba. We also have a second children's hospital, and we work closely with them. Currently, due to the small structure of the hospital building, our emergency department has been completely transformed to a COVID department for reception of suspect cases and treatment of confirmed cases. The general pediatric emergency has been transferred in a second children's hospital, and the population has been informed by this decision. So, for the second question, okay, our definition of suspect case, we consider that a suspect case is a case with acute respiratory symptoms, fever, cough, shortness of breathing, etc., and having an epidemiological link with a region with a local transmission, or having been in contact with a confirmed or probable case in the 14 previous day previous the apparition of the symptoms. I know that it's different if we compare with the other definition, but actually this is our definition. For the third question, how we manage the suspect patient in emergency department. So in an examination box of the COVID secret, suspect children are examined by a resident with all protective measures. We reassess the situation, and the main objective is to look for alternative diagnosis and to eliminate other emergency. That's very important for us, and the strategy chosen nationally is to hospitalize every suspected case. Okay, and tested him with the PCR. In addition, we can do an X-ray chest or chest scan d'emblée, and every confirmed case here in Algeria are treated. So this is the particularity of Algeria because of the demography and the social composition, and I will explain this point in the next question. So definition of infected case is a positive PCR, of course, and we consider also a typical scanographic images with a high suspicion, and we can treat these patients. For the fifth question, yes. Of course, if the child has been referred after a family screening, for example, and the infections is confirmed, he will be hospitalized directly in the confirmed sector in our department. But if he is suspicious, he will be directed to a separate area to isolate this patient. Then, when the positive result is obtained, the child is transferred to positive COVID sector. Concerning the caregiver, we don't have a particular screening for us or for parents. And about the clinical picture observed here in Annaba, it's generally an influenza-like illness with fever, cough, and digestive trouble, diarrhea, for example. And we observed one RSDS, and an infant transferred directly in intensive care. It's a 3-month old with the trisomy 21 and cardiomegaly. That's That's what I know about it. I think that it's all for me. Do you have any questions?
So, thank you very much. Do we have any question for Narjess? So, at the end, how many patients do you have in your country? Children?
Children, about 60 children under 15 years old.
Okay, and nobody in the intensive care unit?
And no, in Annaba, no intensive care case.
Okay, and they are all these kids with respiratory symptoms, or you have a typical presentation?
Typical presentation, we have 2 children here in Annaba with cough, fever since 3 days. That's all.
Okay. So if we don't have other question, I think that we can move on.